At the height of the coronavirus pandemic in the US, thousands were dying every day. A public health emergency was declared in 2020 and helped to mobilize resources. It allowed more than 270 million Americans to receive at least one dose of the coronavirus vaccine. As of this week, that's all coming to an end.
The end of the public health emergency signals a transition in our national response to COVID. It will change the ways that we track COVID, the data that's available to us, how we respond to it.
It also means the end of a vaccine mandate that required all federal workers and contractors to receive the jab. And visitors flying into US airports will no longer be required to provide proof of vaccination. But this could be bad news for some Americans who were given access to Medicaid health insurance during the pandemic.
And now, as we transition away from the pandemic era policies, many Americans will need to renew Medicaid, and we expect that a very large number will lose access to insurance. So one concern is that the ranks of insured Americans is going to fall very dramatically over the next several months.
The decision comes nearly a week after the World Health Organization announced COVID-19 is no longer a global health emergency, bearing in mind that it still remains an active threat.
The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about.
New variants of the coronavirus could still emerge and potentially cause surges in cases and deaths. Despite the end of the public health emergency, people in the US will still be able to get vaccines and treatment, but many will have to start paying for the testing. It is Tianshan, CGTN, Los Angeles.